Welcome to Movement Minutes with Marc. Today we are discussing sciatic nerve pain or sciatica, which is pain going down your leg, and stenosis, and why you may be feeling pain when you're walking or when you're running. I know many of you who might be dealing with sciatica might be feeling more pain in your lower extremities. You could feel numbness, you can feel tingling, you can feel pain in the legs when you're walking or when you're going for a run. Many of you may not be able to run. And if you sit or if you bend forward a little bit, then you might feel a little bit better. Now that is the opposite of what happens with most people. Most people with sciatic nerve pain or sciatica, they feel better when they are walking. And they typically feel worse if they are sitting, especially when they're sitting for a prolonged period of time. So the treatment and the recommendations for each of these two conditions, they're going to be a little bit different. So when you're working with a physical therapist, they might be giving you a different set of exercises depending on the results of your assessment. So right now I'm going for a walk in my neighborhood. It's a beautiful day. I'm a little out of breath because I was running earlier, but I wanted to jump on right now to explain to you why you may be getting pain when you're standing and walking and running. And one of the common causes of having pain in those conditions is stenosis. And what is stenosis? Stenosis is when there is narrowing around the nerve root. There's narrowing of the canals that where the nerve roots exit. And you can have two different types of stenosis, the main categories. They are central canal stenosis, that's where the spinal cord is. Well, that area where the nerve roots exit, you could have narrowing. This narrowing could be due to the bone getting built up. It could be because you were born that way. It could be congenital. It could be because there is a disc protruding and it's crowding the space. And it could be the disc material could be touching the nerve root and irritating it, causing inflammation and causing pain. Or you can have something more sinister, like a tumor. Those are rare, but that's also a possibility. And then there's another type of stenosis, and it's called intervertebral foraminal stenosis, and that's where, or they call it lateral stenosis. You can think of it as being on the side of the spine. This is the hole that's created where the nerve roots exit. And so the narrowing of that canal can encroach, and it can lead to pressure on that nerve root, and then that can send a signal down the leg. It could be numbness, tingling, it could be sharp shooting. And so this is how it relates to you standing and walking. When you're more upright, in an upright position, and if you bend backwards, if you go through extension, which is, let me see if I can show you, it's essentially doing that. It's the backward bending movement. Well, that motion leads to more narrowing of those canals. The two vertebrae in that correlate to that nerve root are going to approximate. They're going to get closer together when you extend. So when you're standing and walking, your pelvis might be going into a little bit of an anterior pelvic tilt, which will result in extension of the lower back, which can narrow the space that is around those nerve roots, resulting in compression and irritation to those nerves, which then can cause your symptoms. And some people, this is a tip to be able to reduce some of that. Because I know that's, at the end of the day, that's what we all want. We want to get out of pain. We want to reduce symptoms. We don't want to be in this pain when we walk. So if you bring your pelvis into a posterior pelvic tilt, that's where you create more lumbar flexion, or more of a neutral lumbar spine. And I'll show you that real quick. That's when you are here, and instead of being extended, you tilt, you posteriorly tilt. So that's an anterior tilt, and that's a posterior tilt. It's when you tuck your hips under you, and by doing that, you're gonna position your back in a more neutral position, which is, from the side view, it's an S-shaped curve that doesn't have an excessive amount of extension in the lower back. And that could potentially take away some of that pressure that's on the nerve root. Now, of course, this is not the only thing that you need to do. There are a particular set of exercises that also correspond to this type of presentation. And those exercises are a little bit different than the exercises that somebody would do if they felt less pain when they're standing and walking. And like I said before, standing and walking usually helps sciatica. But for a percentage of the population who is dealing with this issue, standing and walking and running will make it feel worse. So hopefully that helped to clarify some of the issues and the confusion surrounding why you get pain when you're standing and walking. It could be due to stenosis. And just going back to that real quick, stenosis is the narrowing of those canals. That typically, if you have true stenosis, it usually gets worse when you're arching your back. So every time you do that, you might be getting symptoms going down your legs. And stenosis often happens in people that are over 60 years old. So there is the result of degeneration of the spine and buildup of bone. And then you combine that with your genetics and your predisposition to having stenosis, and then that's what results in that condition. Now, many people get misdiagnosed with stenosis because the narrowing of that canal may be created from that disc herniation or a disc protrusion, which may be encroaching, that disc may be encroaching onto the nerve root and creating this narrowing of the canal. And if the disc is protruded, not herniated, but if it's just protruded, many times you can reduce some of that protrusion through these repeated movements. And these repeated movements need to be identified by a trained professional, like a physical therapist, who could figure out what types of these movements are going to centralize your symptoms. That's where your pain is going to move from the legs to the center of the back, and that's a good sign. That's a sign that you're getting better. So if you have any questions, just write them in the comments below, and I'll try to get back to you. I get a lot of messages each day, but hopefully this helped you to understand sciatica better and some of the different types. This is just one presentation of sciatica, one pattern, but it is a pattern that's recognizable in a lot of people. And that's really important when you're trying to rehab from this condition. And lastly, you do not have to go through sciatic nerve pain rehab alone. Join our free sciatic nerve pain Facebook support group. This is a great community. You could learn from other people that are dealing with the same issues as you or something similar. It would take you weeks and months and years to piece together all this information. And what I love about this group is that you could learn what other people are doing. You could see what's helped them, you could see what they're getting frustrated with, and you could find different sources of information and educational material that could help you identify what's the right thing for you to do. Now, just remember that this is not to replace medical advice, it's not medical treatment, but it's simply to hear about what other people are doing so then you can get informed and educated and then ask your doctor about those things. But ultimately, you always want to consult with your doctor when it comes to something like sciatica because there's a lot of different sources of pain and you want to make sure that there's nothing bad going on. So if you want to join our sciatic nerve pain support group, I'll put a link in the description where you can access that. And also, we have a free sciatic nerve pain guide. It's a quick start guide with some exercises, some examples, some instructions, and some good information about what you can do to rehab and recover from this really frustrating injury. So if you're interested in that, I'll also put a link in the description below. But until I see you in one of those groups, I hope to see you at the next video, and I wish you the best for your recovery.